What is the prostate and what is its function in our body?
So the prostate sits between the bladder and the penis.
Okay.
So you get the bladder is like a bag. The urine comes from the kidneys, goes into the bladder, and then the tube that it goes through, we call the urethra, goes through the prostate, which is a round organ that sits below the bladder and before the penis. So when you urinate, when you pass urine, it goes through from the bladder through the prostate out the penis. And in terms of its purpose, it produces fluid. So the way that fertility works is sperm cells, the little cells that go to fertilize the eggs, those are made in the testicles.
Right.
And so when a man has an orgasm, nature wants those sperm cells to swim up and get into fertilize the egg in the woman. So the ejaculate itself tends to be sort of like a jelly material. Okay. And actually we're going to talk more about it later, the PSA, which is a blood test that stands for prostate specific antigen. It's actually an enzyme that causes the gel to liquefy. So you get liquefaction of the ejaculate, which is probably involved in fertilization. So the ejaculate is produced largely, that fluid is produced by the prostate.
Is a diagnosis of prostate cancer, should it be a death sentence?
It should not be a death sentence. Most men, first of all, the average age of the person who's diagnosed with prostate cancer currently is around 66. So it tends to come on at a point in your life where you're getting close to retirement, you're a Medicare patient, it's not for the younger people. I mean, you can see it in people in their 50s, even in their 40s, but the median age is 66. And most men that are going to have serious prostate cancer are getting close to 70 or even 80. So, and in terms of being a death sentence, the natural history of prostate cancer is quite long. So in many cases, even if you don't have any treatment, you can live a long time, but your quality of life is liable to decline if you don't get treated. So that, eventually it can kill you, but it tends to do so very slowly. So it's not a death sentence, and it can be effectively treated and cured.